Hi, I'm Sarah Patterson and this is my intradermal OSCE. So before I do this procedure, I'm just going to gain consent from my patient. I'm also going to explain the procedure to them, so I'm going to give them an intradermal injection, and this is to prevent IV cannulation pain for later on. I'm also going to check that the patient doesn't have any allergies to any anesthetics, including the drug we will be using today, which is lignocaine. So first I'm going to pick a vein that I will be cannulating later on. But first, I'm just going to say that I'm wearing my personal protection equipment, so I'm wearing my gloves and my goggles. I've also got my sharps container out, and I've got all my necessary equipment. So I've got my gauze pad, my sharps, my medication sticker, a 3ml syringe, an alcohol swab, lignocaine, my drawing up needle, my giving needle. So today I'll be using a 27 gauge needle. So now I'm going to pick the vein that I'll be cannulating later on. So I'm going to choose one of the metacarpal ones, and I'm going to cannulate parallel to that vein. So I'm going to get out my alcohol swab, and I'm going to clean the site in circular motions going outwards, and this is to prevent dirt from going in later on into the injection site, so we don't want that. So now while I wait for that to dry, I'm just going to check my drug. So lignocaine expires in 2020, and I'm going to check the dosage as well. I'm also going to get my partner to check that and read that verbally back to me so that I know that the drug is good to use. So now I'm going to draw up my drug. So I'm going to get out my drug and attach it to my 3ml syringe. So I will be drawing up 10 mg of 1 ml of 1% lignocaine. So just warning everyone that sharps it out. And I'm going to draw up 1 ml. So as soon as that is done, I will put the cap back on. That's just following sharps etiquette and making sure there's no air bubbles in the syringe. So once that is done, I'm just going to check that that is 1 ml. And I'm going to check get my offsider to check that and verbally read the amount back to me so that I know that it's the correct dosage. So once that is done, I'm going to take that off, put it straight into the sharps container, and attach my 27 gauge needle. Just warning everyone that sharps it out again. So once that is done, I'm just going to warn the patient that I'm about to inject them, and I'm also going to tell them that this could cause a stinging effect. So I've tried to minimize this by warming the solution prior to drawing it up. So now I'm going to take the cap off, so warning everyone, sharps it out. So I'm going parallel to the vein that I'll be cannulating later on, stretching the skin, going in at 15 degrees. So once I'm in, I'm going to aspirate, and that's just checking I'm not in a blood vessel. So I've got no blood in my syringe, so I'm happy I'm not in a blood vessel. So I'm going to slowly administer the drug. For the purpose of this demonstration, since I'm doing on the mannequin arm, I will not be administering it, but you would slowly administer it. So now I'm going to watch for a bleb. This bleb should be about 4 to 5 millimeters. Once I'm confident that there's a bleb, I'm going to remove it. And I'm going to put the cap straight back on and put it straight into the sharps container. So once that is done, I'm going to wait for 1 minute to cannulate. I'm also going to document the time I gave it, the drug I gave, and the amount I gave, and the route. So intradermal lignocaine 1 ml at 10:30. And I'm also going to assess for signs of allergic reaction. Thank you.